Now we move on to Dr. Soumya Nambiar. She is going to talk on the evaluating a child with strabismus.
So good morning all. First of all, I would like to thank KSOS and Dr. Ramya for having given me this opportunity. So strabismus per se is challenging in adults, and in children it is even more challenging. So whenever you have to see an object, to get a three-dimensional picture, the images of that object should fall on a disparate retinal points in the Panem's fusional area. Only then you will be seeing the object in a three-dimensional picture. But what will happen when there is a misalignment? These images do not fall on the disparate retinal points in the Panem's fusional area, and the child or an adult usually starts seeing double vision. But in children, what they do is that they start suppressing one eye, and then there is a loss of depth perception, and they may lose sight permanently. Okay? So strabismus is a common disorder of ocular alignment affecting about 2 to 4% of general population, and therefore early detection has a definite role in reducing the incidence of amblyopia. So today, let's see how do we evaluate a child with strabismus, though it's easily said but difficult to do definitely. So early recognition of strabismus is needed in order to prevent permanent functional issue, to prevent psychosocial distress in children, to prevent amblyopia, and you need to catch them during the critical period of development and also during the modifiable period of neuroplasticity. So always you can start your examination by observing the child as the child enters your room, outside your OPD room, as well as the child enters the room and goes on till the child is leaving. You can always observe when you keep asking history with the parents, and in the history you need to ask about under the following headings: how did they start, whether it was recent or it's there since birth, what is the frequency, the birth history, any perinatal, natal or postnatal issues, whether this strabismus or a misalignment started following an immunization, any family history, and if the child has taken treatment in the past. Always start your visual assessment, as Ramya has already told, with age-appropriate charts. And remember that you should always check the near vision as well, because that is the one which decides whether your amblyopia treatment is going to be effective, and that's the first one which improves. Then Ramya has already told about the CSM method. Okay, this is the most important method, especially in a child who is not going to cooperate. And she has already told in detail what is going to happen. So you can see the central steady fixation, and as in this child, you can see that there is a central unsteady fixation. And the important thing is that you have to look for the maintenance of fixation. So how do you check for that? She has already told. I'm just telling little more about it, is that by this you will know which eye is going to be dominant and which eye the child prefers to see. So you can see when I covered the left eye, the right eye is fixing, and it is maintaining fixation when I uncover. And when similarly, when the right eye is covered, the left eye from outward position has come to the central position, and when I remove the cover, the left eye, you can see it has gone back to its original position, which means that the child is preferring the right eye. Always look at the abnormal head posture, which decides upon which type of muscles that you have to look for when you are seeing. Whenever a child comes with an ocular instability in infancy, up to 3 months, if there is a less than 15 degree and up to 3 months, you can usually observe, but remember, rule out other causes. Do a dilated examination, do an anterior segment examination, then you can observe the child. But if there is an ocular deviation which is persisting for more than 3 months, if the deviation is more than 15 degree, it has to ring bells. There should be some problem that is going on. Pseudostrabismus is one very common condition which can be confused for a true strabismus. So this can be very easily differentiated with your corneal light reflex test. You can see that it is central, and a simple pinch test can also show, you can explain to the parents that that's actually not a true strabismus. A Hirschberg corneal light reflex will help in detecting the amount of strabismus that is present in a child who is not cooperative. So in this case, you can see the reflex that is falling at the pupillary area. So you can approximately tell that there is around 30% diopters of deviation of ESO or EXO in each case. A modified Kimsky test will help in quantifying the deviation. Remember to always start your examination with sensory evaluation. And why this is so? Because you need to do this examination before you dissociate the eye. always start the test for stereopsis, and you know that there are different tests for stereopsis. What we usually follow here is the Titmus fly test. So as you can see here, the child is asked to wear the Polaroid glasses and asked to catch the wings of the fly. And you can see that if the child is having a 3 division, he catches above the book, and you have these grades of animals and these rings which are popping out. So you can ask the child to press that, whichever is popping out. So by this you can tell the stereoacuity. TNO is another test wherein you ask the child, you can see, to wear the red-green glasses and check for the stereopsis. If the child refuses to wear glasses, definitely you have tests called Lang test, which doesn't require any glasses, and the children are very cooperative to do this. Worth fodder test is one test which helps in detecting if there is a fusion or not. The child is made to wear red-green glasses. It helps in detecting if there is a normal vision or there is a normal fusion or there is suppression. But remember that you have to always do a near Worth fodder test as well, because cases like microtropia, they tend to suppress for distance, but they may fuse for near. The a disadvantage of Worth fodder test is that eyes are easily dissociated in this condition. So a patient who is having a functionally useful binocular vision may actually show a suppression when you do a Worth fodder test. And another disadvantage of this Worth fodder test is presence or absence of bifoveal fusion, or there may be a bifoveal fusion even in cases of an abnormal retinal correspondence. Begolini stride glasses is less dissociative when compared to the Worth fodder test. So it is more testing the reality, what you do. So this is more preferred than you do a Worth fodder test. So as you can see the striations which you saw on the glasses, and corresponding to that you can see a cross, or if there is a suppression you will just see a single line. Then you go on for motor evaluation. So in motor evaluation, the cover test. This is the most important test to detect the amount of tropia. So as you can see here, when you cover the right eye in this child, the left eye is taking up fixation. When you remove the cover, the left eye goes back to its original position, which means that the child prefers the right eye and the dominant eye is the right eye. In case of a uncovered test, it helps in detecting a phoria component. So you can see that when you cover, you don't see the movement in the other eye, but when you remove the cover, you see under the cover of that eye, and that amount will show the phoria component. So the uncovered test basically measures the phoria. And then you have the alternate cover test, which measures both phoria and tropia. Remember to do a cover test for near as well. And this is the prism cover test, which helps in measuring the amount of deviation, as in here I have placed a basin prism. And always look at the extraocular movements. Ma'am will, the next speaker will all be talking about the extraocular movements. So definitely you have to look at the extraocular movements, which has been, which muscles are being acted. And remember one thing, that when you are checking for a child, always correct the posture, because that is when the deviation will manifest. And then you go on to look for the movements and see if there is a limitation of the extraocular movements. So sometimes if you don't do the extraocular movement examination, you miss out these conditions. And more than the pediatric refraction, which Ramya has already told about the importance of it, but remember that there are some deviations which can merely be corrected with glasses. So if you identify it, you can give a full strabismic correction for the child. Bruckner's test, she has already told about it, and this helps in detecting strabismus, especially in the strabismic eye, the images will be clear. And anterior and posterior segment examination is definitely mandatory in all cases of strabismus, not to miss out anything else. And this is the consensus which has been given when to examine the child. At least by 3 years, the child has to be examined once. Thank you, one and all.
Thank you, Dr. Soumya. That was an extensive talk on strabismus